Rob Kominiarik, visiting you from the Age Management Medical Group Convention in the Bellagio Hotel in fantastic Las Vegas. Today I'm honored to be here with Joseph Raffaele, who is located in New York City.
That's correct, Rob.
And there's a lot of work that you've been doing over the last several years and noteworthy in the arena of telomere science. Maybe you could educate us as to the things that have changed over the last several years.
Well, I started researching telomere biology and its clinical applications about 8 or 9 years ago. I was lucky enough to be involved in one of the first studies administering a telomerase activator to human subjects. We found beneficial results in immune function and in some metabolic parameters. We went on to show in a randomized controlled trial for the first time that a telomerase activator could actually lengthen telomeres, which was very exciting. And since then, there have been many, many studies coming out showing telomerase activation is important for all aspects of the aging process, associations with chronic diseases of aging. So I think it's all starting to come together in a really interesting fashion for me. Here at this conference, we had the sort of a very interesting cohort group that all got their telomere tests done, their immune function done, and the results from a, I guess, relatively random group of doctors and other practitioners who were interested in getting their telomere lengths checked and their immune function checked was very similar to the literature, and we talked about it, and I think a lot of the practitioners came back to me and they're going to bring it back into their practices to try to use telomere biology and keep people healthy by activating telomerase. So I think that's going from sort of early on in my career to just doing research with a very small number of people to seeing it spread. It's sort of like what happened with vitamin D in some ways. It's sort of I think of telomere biology as being the new vitamin D.
Yeah, it's a very interesting field for sure. You mentioned some chronic diseases that impact telomere length. Which ones in particular have the most profound effects?
Well, certainly chronic infectious diseases can stress the immune system all the time. There's associations between cardiovascular disease and telomere length, telomere biology. It's interesting, and a study that was done a while ago now, but is I think interesting for people to understand is that if you have long telomeres, you probably don't have adverse effects from high cholesterol or some of the other risk factors because you can repair your arteries, the lining of your arteries. But if your telomeres are short, then you can't do that. And it showed that if you, say, for instance, use a cholesterol lowering medication and you have long telomeres, you don't really get the benefit because you don't need it. It's not damaging it. And then there's this whole area that's been fascinating for me is this benign virus that we think of called CMV, which is one of the herpes viruses, same as gives you cold sores or gives you, genital herpes or chicken pox, all those groups of herpes viruses. This one is thought by most doctors around the world to be something that you really don't have to worry about unless you're immunocompromised, such as being on immune suppressants after a transplant or having AIDS or being very, very ill, where it does cause clinical disease. In normal humans, it doesn't cause anything, you don't even know you get it when you get it, but it sort of ages your immune system more rapidly than if you didn't have it, but it's a slow process that has profound effects in your 60s and 70s, and then can actually take a lot of quality years of life from you at the end of your life. So looking at that and understanding how the research that's trying to really address that virus has been a kind of an interesting thing. We did that in the cohort. Hopefully they're going to give us our results back.
Sounds like a slow ticking time bomb.
That's what I think of it as. It's sort of a very, very slow HIV. And I know it's a controversial thing to say, but
sure.
That's what it is.
But it impacts your overall health and wellness and your potential longevity. Mm-hmm. So are more common infections like the common cold or influenza or those items, how do those impact telomere?
Yeah, anything that stresses your body, be it infectious like the common cold or psychological stress that we know of being a caregiver of an Alzheimer's patient or a very sick child.
Executive stress.
Executive stress, but it's important to understand that if it's stress that you're mastering, in other words, you may be in a stressful job, but if you're responding to it through meditation or because you've gotten good at it, then even though it seems like it's stress, if it's not perceived as stress, it doesn't have the same effect. But anything that makes your body have to repair itself more causes your stem cells in all your tissues to divide more rapidly and the telomeres shorten. And that is where this whole thing integrates. The whole mitochondrial theory of aging, where you have to have energy generation, is associated with telomere biology. Hormones are associated with telomere biology. It's all comes together. And what I think of as sort of a unified theory of aging that puts together all the different aspects that we thought were competing. Now they're all integrated into, I think, a really interesting kind of a unified field theory, like in physics, in aging now.
Very interesting. So how about a solution to maintain telomeres or even improve the length of telomeres?
Yeah, well, it's solutions. I mean, that was what was very interesting about our telomere biology workshop that we had here at the pre-conference. We heard from doctors who are involved in lifestyle changes, diet, exercise that have been shown in association studies and in some prospective studies to improve or maintain your telomere length, vitamin D, omega-3 fatty acids, et cetera. Certain kinds of exercise that I know that you're very much involved in. And then actual molecules like the telomerase activator, TA65 can do that. We've shown that in that study. And there are more things coming down the pike. There's actually one woman in the world who's done gene therapy with the enzyme that can turn on telomerase. So I think there are definitely more things coming down the pike. They're actively being researched to try to help people keep their telomeres longer, because if they get to a certain critically short level, that's it for you.
Yeah, that's never good. Right, want to maintain that telomere.
Right.
Well, fantastic. Thanks so much for joining us here, Dr. Rob Kominiarik with Dr. Joseph Raffaele here at the Age Management Medical Group at the Bellagio Hotel in Las Vegas, Nevada.
Thanks, Rob.